Hi, I'm Andrea, and I'm a NICU nurse. Part of my job at GE is to work with customers around the country on how to understand and use our products to treat and help take care of their babies. We wanted to do this special series for you on phototherapy because we get a lot of questions on it. A lot. And there's so much misinformation and confusion on phototherapy that we wanted to bring this series of videos to help you use phototherapy to treat your babies. So to kick off the phototherapy series, I wanted to quickly share with you the key things that you need to know to use phototherapy. I'm not sure if you all know this, but jaundice is very common and affects 3 out of 5 babies born. That's 60% of babies born. It's so common that in one study published in Pediatrics, it showed that 35% of early readmissions of apparently healthy newborns were because of jaundice. And then, almost all preterm infants less than 35 weeks gestational age have elevated total serum or plasma bilirubin levels. So even though jaundice is fairly common and the treatment looks as simple as using a light, you can't imagine how many questions we get from customers on how to use our BiliSoft or our overhead phototherapy properly. Even when I walk into some units, I'll see a baby with 4 phototherapy lights on them, which is not necessary. So first things first, there's 2 major types of jaundice, indirect. And if it is indirect or non-conjugated jaundice, then it can be treated with phototherapy or light therapy. Indirect jaundice is the more common one, and that's what we're going to talk about today. Back in 2004, the American Academy of Pediatrics, the AAP, came out with the Clinical Practice Guidelines, Management of Hyperbilirubinemia in the Newborn Infant 35 or more weeks of gestation. Per the AAP guidelines, effective phototherapy is an equation of the exposed surface area coverage, light wavelength, the irradiance or intensity of the light. And equally important is the duration of exposure to phototherapy to decrease the bilirubin to safe levels. These 4 things help to make up the effective overall dose of phototherapy. So, the most important factor is irradiance, the light intensity level expressed in microwatts per centimeter squared per nanometer. Phototherapy is delivered within the spectral range where the bilirubin molecule's maximum absorption of light occurs between 450 and 460 nanometers. Now, intensive phototherapy from the AAP guidelines says that intensive phototherapy implies irradiance in the blue-green spectrum, wavelengths of approximately 430 to 490 nanometers. Our BiliSoft and Giraffe Blue Spot and regular Giraffe Spot phototherapy meets these specifications under certain conditions. The more body surface area exposed to light, the better. So you might hear of double phototherapy, and this is where it can apply. The right way to do double phototherapy is putting an intensive light underneath the baby and an additional intensive light overhead to cover the complete body surface area of the baby from head to toe. So the wrong application of double phototherapy is thinking that 2 + 2 = 4. So for example, if you use 2 overhead lights that both have an irradiance of 20 microwatts per centimeter squared per nanometer, you may see a nominal increase in the irradiance level, but you will not see it increase to 40 microwatts per centimeter squared per nanometer. So let's talk about duration of phototherapy exposure. Generally, you don't need to interrupt phototherapy for clinical care or family bonding. And what most people don't realize about phototherapy is that you need to check the dose of your phototherapy device utilizing the meter designed for that specific medical device validated for use by the manufacturer. So for example, if you have a GE phototherapy device, always use the BiliBlanket Meter 2, or if GE should adopt a new meter in the future, it would be validated for use with our devices. While you are waiting 6 minutes for it to warm up, place the fiber optic light pad on a flat surface. Do not place the fiber optic light pad inside of a BiliSoft pad cover or BiliSoft Nest at this time. Use a calibrated bilimeter that is approved for the BiliSoft 2.0. I'm using the approved Omeda Medical BiliBlanket Meter 2. Take measurements on the lit side of the pad using the meter placed at points as shown on the back of the pad. So, take out your BiliBlanket 2 meter. We'll check to make sure the batteries work. Set the on-off switch to the on position. A zero adjustment is performed automatically when the switch is set to I or on. You'll see that Cal will be displayed during zero adjustment. Zero adjustment is performed electronically, so no cap is required. When zero adjustment is complete, the Cal message will disappear. Just remember, when you're doing this, make sure to keep the meter still. Do not subject the Billy Blanket meter 2 to shocks or vibration, especially at the time of zero level adjustment. Inaccurate readings may result. You'll need to install new batteries if the display window is blank or a battery mark will appear above the measured value. If you continue to use the instrument, the mark will start to blink and measurement will no longer be possible. To quickly measure the irradiance of the BillySoft, set the Hold Run switch to the Run position. It's this round button here. The Billy Blanket meter 2 now performs continuous irradiance measurements. To freeze the display and irradiance reading, press the Hold Run switch push button to set it to its inward hold position. This freezes the display reading at the current spectral irradiance level. So, for the small BillySoft 2.0 pad, if I take the readings in the middle, C and D, and take the average of C and D, if it is greater than or equal to 60 microwatts per centimeter squared per nanometer, then it works. If you get less than 60, you'll want to do a full check. You check all 6 points and you take the average. If it is less than or equal to 39, then it's time to replace the LED in the box. If you have the large BillySoft 2.0 pad, to do the quick reading, check the center row, D, E, and F, and take the average of it. If it is greater than or equal to 40, then it's okay to use. If it's less than 40, then do the full 9-point check. If the 9-point check's result is less than or equal to 27, then it is time to replace the LED. Now remember, the BillySoft 2.0 unit should work fine for over 50,000 hours of use. This is an improvement over the old BillySoft phototherapy system, which would need replacement after 8,000 to 10,000 hours. Focus the therapeutic light such that the shade is 38 centimeters, which is 15 inches from the bed surface. Or you could measure the spot diameter to be 35.5 centimeters, which is 14 inches. Allow the Giraffe Blue Spot PT light to warm up for 5 minutes. From my experience, this is when I would go look for the Billy meter. This is probably how long it takes to find one. Using a calibrated Billy Blanket light meter 2, measure the light at the 5 light measurement points and calculate their average. The way to remember it is, take a reading at the center of the circle. Now imagine that circle is divided into 4 quarters. Measure the center of each quarter. Confirm that the average is at least 27 microwatts per centimeter squared per nanometer. If not, have your biomed take a look at it to see if the LED bulb or something else needs to be replaced. Divide the lowest reading by the highest reading. If the LED light is functioning properly, the result should be greater than 0.4. If the result is not greater than 0.4, contact service. So, if you found this helpful, stay tuned for the next episode of our phototherapy series.